Hi everyone, today I'm talking about eye drop administration. So when you have somebody that has eye drops, the first thing you want to do is go ahead, take a look at their medication administration record and make sure that it is the right person, that it's the right time to do it, that you know the eye and you know how many drops are going into that eye. Once you've ticked that box, you're going to go and wash your hands or use sanitizer on your hands if you can't get to a sink with soap and warm water. Sanitize. You're going to put gloves on. You never want to do a procedure like this because there can be bacteria that you are introducing into their eye or that you will be taking with you when you are done. So clean hands, gloves on. If you look at their eye and there's some drainage coming out, if it's a little mucky, there's some crustiness around it, you're going to want to get a warm cloth. Go to the sink, just get tap water, nice warm water, nothing hot, and you're going to clean from the inner to the outer canthus. So wrap it around your hand, make a little glove, and clean from the inner to the outer. If it's still mucky after the first pass, flip it over and do the same thing again, okay? And if you're dealing with two eyes and they're both mucky, we're not going to assume that it's the same thing in both eyes, although in most cases it is. You're going to get a different cloth, you're going to get different gloves, you're going to sanitize your hands again, and you're going to go through that whole process again for this eye. Now, when you get to doing your eye drops, you've already cleaned, you've got fresh gloves on after cleansing around their eye if it's necessary. You're going to put your gloves on and you're going to make sure the client is tilted back and in a good position that you can use gravity on your side. So you're going to tilt them back and make sure that you can reach the pocket of their eye. So this is called a conjunctival pocket. You're going to have them tilt back in their chair or in their bed. You may be even sitting them up a little bit in a sort of semi-fell or half sitting position so you can get a good angle. You've got your fresh gloves on, you've got your right eye drop, you know how many are going in, you know the eyeball, you know the person, you know everything about the situation. You are ready. You have good lighting and you are ready. So what you want to do then is you take your non-dominant hand and you secure it on your cheekbone. So you go to your cheekbone and you just pull down and you're going to get that nice pocket right down at the bottom of their eye. That's where you're aiming for the eye drop to go. So secure your hand here, pull down, less of a chance of poking yourself in the eye or poking them in the eye in this case. And then you want to use the forehead as the other anchoring point. So anchor here on the cheekbone, pull down, get your pouch that you're going to be using, anchor on the forehead. You've got your eye drops, your head tilted back, you catch that pocket, you put your two drops in. The person's going to close their eye because that's a natural thing to do, and that's a good thing. It's going to spread the medication across their lens, and then any extra you're going to just remove with a tissue. That is the ins and outs of it. And then of course, when you are done, you're going to chart that you have done it and you're going to be a star at doing eye drops. Thanks so much. Take care. Bye.